Assalamu alaikum. Hi everyone. Welcome to my channel. In this video, we will learn about urine analysis. A simple urine test can save your life. What is urine analysis? Urine analysis, also called urinalysis, it is one of the oldest laboratory procedures in the practice of medicine. It is also known as urine R and M, means routine and microscopy. Why we do urine analysis? Why doctors suggest urine analysis? Because it gives general evaluation of health. It is used for the diagnosis of disease or disorders of the kidneys or urinary tract. It is used for the diagnosis of other systemic diseases that affect kidney functions. Also, it is used for monitoring of patients with diabetes and used for the screening of drug abuse. Container for urine specimen. It is advised to collect urine sample in a completely clean, sterile and wide mouth container. Here we use two types of container mostly. One is blue top container and second one is red top container. Blue top container is sterile, doesn't contain any type of chemical, but red top container contains boric acid, which is used to preserve urine sample for up to 72 hours. It causes sample to be static. Types of urine sample. There are basically different types of urine sample which is required for different type of test which has different purposes. Like a random sample with no specific time, it is most common taken any time of the day. It is used for routine screening. When we require a urine sample for pregnancy test or other microscopic tests, it is required to take sample in the morning, which is the first urine in the morning, and it is most concentrated. Urine required for urine culture is a clean catch midstream, means discard few samples and collect the rest. 24-hour urine samples used for qualitative and quantitative analysis of substances, means all the urine passed during day and night, and next day first sample should be collected for 24-hour urine analysis. Postprandial means 2 hours after meal. It is used for the determination of glucose in diabetic monitoring. Suprapubic aspired means needle aspiration of urine, and it is used for obtaining sterile urine sample. What to look for in urine analysis? Urine analysis consists of the following measurements: macroscopic and physical examination, chemical examination, and microscopic examination of the sediment of urine. Physical examination of urine includes volume of urine, color of urine, and odor. Chemical analysis of urine includes the identification of protein, glucose, ketones, blood cells, pH, bilirubin, urobilinogen, ketone bodies, nitrites, and leukocyte esterases. A variety of normal and abnormal cellular elements may be seen in urine sediment, such as various crystals, cells, cast, and other microorganisms. These are different types of cast, cells, microorganisms which we see under microscope during microscopic examination of urine. Crystal depends on pH of the body. Some crystals formed under alkaline condition and some forms in acidic condition. Uric acid, triple phosphate, and calcium oxalate are most common types of crystals found in urine sample. Urine analyzer cobas 6500. In modern days, manual microscopy is not performing because of automatic analyzers are easily available. How to run cobas 6500? Cobas 6500 is consist of two parts: U601 for chemical analysis and U701 for microscopy. First, you have to paste the specimen barcode on 15 ml conical and pour urine sample up to 9 ml. Then set the 15 ml conical on the Cobas specific Rex and place it on the input buffer of U601. Analyzer automatically read the barcode and perform chemical and microscopy and send the results after verification into lab integral system or other software which are used in. So it's all about overview of urine analysis. Stay tuned for more videos. Thanks for watching. Please like, share and subscribe my channel.